After getting over the initial shock of learning that they're carrying multiple babies, many twin parents are anxious to find out if the babies are fraternal or identical, and if they are the same or different sexes. How can they determine what type of twins they're carrying? And are there any special concerns associated with each? I'm Dr. Sean Donishman, perinatologist at the San Diego Perinatal Center, here to talk about identifying twin types during pregnancy. This is Twin Talks, episode number 7.
The ultrasound shows your babies to be healthy.
What? Did you say babies? You're huge. Are you having twins?
Are they natural?
Which one do you like better?
Twins, huh? My neighbor's cousin's brother's uncle's a twin.
So can they read each other's minds?
How do you tell them apart? Twins? You got a 2 for 1.
Do twins run in your family?
Double trouble. You're not having any more, are you?
At least you're not Octomom.
If you're pregnant with twins or you're an experienced twin parent, odds are you've heard it all before. Now it's time to hear from the experts. This is Twin Talks, Parenting Times 2. Welcome to Twin Talks, broadcasting from the Birth Education Center of San Diego. Twin Talks is your weekly online, on-the-go support group for expecting and new parents of twins. I'm your host, Christine Stewart Fitzgerald. Have you heard about the Twin Talks Club? Our members get bonus content after each new show, plus special giveaways and discounts. Subscribe to our monthly Twin Talks newsletter and learn about the latest episodes available. And another way for you to stay connected is by downloading our free Twin Talks app, available in the Android and iTunes marketplace. So let's get started, and we've got some panelists here in the studio with us today, and let's start with Carolyn. So tell us maybe a little bit about yourself, your twins, and hear about you.
Okay, yeah. Hi, my name is Carolyn, and I have fraternal girls, Lauren and Kyla, that are 19 months old now. I'm a stay-at-home mom with them, and previous to that, I was a scientist, and they're my only 2 children now.
Oh, well, hey, that's a handful, I gotta say. Definitely. So, scientists, I gotta ask, what type of science?
I did cancer biology and a bit of osteoporosis studies.
Oh my gosh! So you know a lot of medical terminology too. Okay, well this is good. We can ask you as an expert as well.
I don't
know. Okay, and let's see. And Shelly.
Hi, I'm Shelly. I'm a high school history teacher. I'm 30, and I have 2 children, identical twin boys, Grayson and Sawyer, and they are almost 15 months.
Awesome.
And I'm Sunny. I am actually pregnant with twin identical girls, due December 2nd. That's our C-section date. I have 2 little boys at home already, Sayer, who's 3 years old, and Urban, who's about 17 months.
And so this is going to make 4. You're going to have your hands full.
I am. I'm learning from all of you ladies, though. I'm taking notes on how to do this. Right.
Amazing. And I'm Christine as your host. I've got 4-year-old identical twin girls. And then I've also got another little girl, Singleton, who will be 1 year in a week from now. So all girls, like I say, I think we are done. Girls is great. We're happy.
We have our annoying comments from Twin Mom section today, and this one comes from Melissa in Texas. She says, I have a 12-year-old, a 7-year-old, a 3-year-old, and 18-month-old identical sons. When people say, I don't know how you do it, I usually respond with, I have a glass or 2 of wine after they all go to bed. The most annoying comment I hear doesn't come from a stranger, though. Whenever my mother-in-law sees the twins, she always asks which is which. When I tell her, her response is always, are you sure? Hello, I think I know my own children.
So today's topic is identifying twin types during pregnancy. We're talking with Dr. Sean Donishman, a perinatologist and an expert in maternal fetal medicine. And as part of his practice, he often helps pregnant twin moms diagnose their twins' type and helps them manage a healthy pregnancy. So thanks for joining us, Dr. Donishman.
Thanks for having me.
Well, this is great. So we talked in an earlier episode about just kind of the science behind twins. And so now, let's just say we come and we see you, and we want to know, are our twins identical or fraternal, and how do doctors know if the developing twins are fraternal or identical?
So the best way to diagnose twins, obviously, as we talked about previously, is by doing an ultrasound. Fraternal versus identical. So fraternal or dizygotic twins is ovulation and fertilization of 2 separate oocytes, and identical or monozygotic is fertilization, ovulation, or ovulation and fertilization of one oocyte and then divides. What's really important, Christine, is identifying whether there are two placentas or one placenta in a twin gestation. So about 1/3 of identical twins can have two separate placentas. So it's not really that important whether they're identical or fraternal while they're pregnant. We can obviously determine that after the babies are born, but what's really important and what changes the management of the pregnancy is the number of placentas.
Okay.
And that can be determined by ultrasound. And the earlier the ultrasound, the better it is for us to be able to identify that.
You're saying that the placenta is the main factor, so it's not so important if they share the same sac?
So that's also important. So if they have two separate placentas, they will have two separate sacs. If they have one placenta in identical twins, then 1% of the time they may be in one sac, and that carries a high risk. So that's called monochorionic, so one placenta, monoamniotic, one amniotic sac. And those babies are at a higher risk of passing away, and if one baby passes away, this is due to cord entanglement. So if 100% of the time the cords are entangled because they're swimming around in the same sac. And so what's important is to admit these patients a little bit earlier. So these wonderful moms come in, 24 weeks, 26 weeks, 28 weeks, depending on their discussions with their doctor and the neonatologist, depending on how early they want intervention. Some parents say, 24 weeks, I want everything done. You're in the hospital at 24 weeks. Some parents say, I want it at 26 weeks. So, and then delivery is anywhere between 32 to 34 weeks with those babies. So that's 1% of all identical twins or monozygotic twins. But when fraternal twins, always two separate placentas.
So it sounds like it's pretty obvious for fraternal twins because there's the two sacs,
Yes.
two placenta. So
And in 1/3 of monozygotic identical twins, still two separate placentas.
okay. So now if you're performing an ultrasound and you see there's two sacs and two placentas, but we still don't know if it's identical or if it's fraternal. I know, like in my case,
Unless they're different sexes.
These are different sexes.
Right.
If
the sexes are different, then they're fraternal. But if
Okay.
they're the same sex, you're right. You can't tell the mom 100% these are fraternal.
And usually the sex, unless it's, if it's done via ultrasound, that's done in the 26 or what's the time period?
As far as being able to tell the sex?
Yes.
Early on, we can tell the sex maybe as early as, sometimes 13 weeks, 14, 15 weeks, we can be able to tell the gender.
Yeah.
Yeah.
Did you, and so here
I
in the
had
house-
mine at 18 weeks. So I had a similar situation. I had two separate placentas, two separate sacs. We figured fraternal. And I had they call it the anatomy scan, make sure everything's all in one place. And they said ideally between 18 and 22 weeks is when they have enough room to see
Right.
everything and they're
Right.
developed enough. So mine was right at 18 weeks. And they were able to tell us that they were both boys, which then kind of in the back of my mind, I
Right.
was thinking, well, I guess they could be identical.
Right.
But it sounds like at that point they said, well, they're boys, but you still didn't know if they were fraternal or
No,
identical.
we had no idea until after I delivered and they had the same blood type, which we only found out because of ABO incompatibility. They normally don't blood type babies unless there's a reason to. And so with the same blood type and two babies who looked exactly the same, we thought maybe we should check this out. So we actually had private genetic testing done when the boys were about 4 months old.
Yeah. So when you see a wonderful mom early on in the pregnancy, you look for several signs. One is you want to see a dividing membrane. When they're early on, you can see that much more clearly than when the babies are older. The membranes become much thinner. So you want to see in two separate placentas. You want to see something called the lambda sign or a twin peak sign. That's when the fusion of the two placentas. So you kind of see this triangular shape with the dividing membrane extending from there. So that's one sign of two separate placentas. Again, forget about fraternal or identical. Think about number of placentas.
Okay.
So that means two separate placentas. Also, the thickness of the membrane is something we look at. Anywhere between 15 millimeters to 2 millimeters, and thickness is more likely that this is two separate placentas. And then again, really the gender, but that's a little bit later on. But those two signs are very important: the thickness of the membrane and that lambda sign. If it's one placenta with two separate sacs, there's something called the T sign. It's basically the placenta, and then you get this extension of the membrane right from the placenta. So you don't have that lambda sign or the twin peak sign that we look for. So there are sonographic features that we look for to identify whether there's two placentas or one placentas, which, as we talked about earlier in episode 1, determines how we're going to manage these angels.
Okay. So you're looking at the sonogram, and then you see that there are, let's say there's two placentas and two sacs. But at that point, we still don't know fraternal identity. I guess, and I think that's probably, maybe it sounds like from a medical practitioner, that's really not so important. But then the parents are still dying to know. They'd like to know.
You would think.
Yeah,
I don't know what you.
Well, yeah, I mean, it was for us. It was
You're right.
we did want to know, and the main reason I was concerned is like we had talked about in that other episode. If you have fraternal twins, then your chance of having fraternal twins is high again.
Right.
And so I kind of wanted to be prepared for that. But also, you want to be able to answer questions. I mean, I spent the first 3 months of their life. People would say, "Are they identical or fraternal?" And I would have to say I didn't know. And then people look at you like you're
what?
like they give you a
why
side
don't you
eye, like
know?
why don't you know about your own children? And so for us, it was just more, just we wanted to know so we could tell people, yes, these are our identical twins. But also going forward, we, in the event that one would have something, like if they ended up having some kind of genetic condition, then we would automatically know that the other one had, kind of a same situation. So it helps a little for their medical history. And also in terms of just like how you look at raising them. I mean, when you have twins that are virtually the same, you have to just different challenges, I think.
Right. Yeah, definitely.
Yeah, I mean, we had, 2 placentas, 2 sacs. We assumed they were fraternal, but then when we went into the hospital, we brought nail polish. How are we going to paint their toes, figure out if they're different. And then when my girls were born, they were a pound different and looked nothing alike and have continued to look nothing alike. So now one has brown eyes, one has blue eyes. So, we did have some genetic testing done because they were part of a vision study at UCSD, and of course it came back they were fraternal, so no surprise.
Mine were within 2 ounces of each other, so we had 2 6-pound babies who looked exactly alike, and we did paint their toenails. For me, it took me about a week, and then I was able to tell them apart. They had a bigger size difference after coming home, like 6 or 7 ounces. It took my husband about 3 weeks that we had the nail polish on them to tell them apart, and we have family members that still can't tell them apart.
Yeah, we knew right away when they, and Dr. D kind of alluded to this earlier, and that is, we found out when we were 14 weeks pregnant that they were twins. And they told us, like, right after they said, "You're having twins." And that was the first question that came out of my mouth was, "Are they identical?" And she said, "Well, let me look." And I later learned that, because I was still early on in the pregnancy, that they could, see the placenta and everything much more clear. In about a month later, I had another ultrasound, and because I wanted to know if they were in separate sacs or not, because they didn't tell me that, and I didn't know to ask. Right. And so about a month later, I'm doing all this research online, and I'm like, well, are they in the separate sacs or is it the same sac? And, what does all that mean? And then it was really hard for them to tell at that time because the sacs had become so thin.
So how would you know if they're fraternal? I mean, are there any types of testing, during the pregnancy that you can perform to find out?
I mean, you could, but it's invasive testing, so it's best, mostly it's done after the babies are born. So obviously it's important to know if they're fraternal or identical, like Shelley mentioned. But as far as the management of the pregnancy, really it boils down to the number of placentas and sacs.
So, I mean, during the pregnancies, I mean, is there any reason that parents should know, or are there any medical reasons that it would be important to know if they're mono or dizygoic?
Well, it's a good question. If you wanted to do invasive testing, let's say one of the babies, for example, has some sort of a congenital abnormality, let's say has a heart defect, and it'll be important to know that's why, since we're not 100% sure if they're identical, and they have 2 placentas. Since you're not 100% sure if they're identical or fraternal, then you want to do an amniocentesis on both sacs, on both babies. And amniocentesis, as everyone knows, is drawing some fluid from the sac and testing the chromosomes, testing the fetal DNA. So because of that reason, we tap both. We don't just assume.
Right. Right. And so when they're doing, I mean, could also genetics is that a factor? I know sometimes parents go through genetic counseling, and again, if there's 2 babies, and let's say they appear like they're fine, but it sounds like you'd probably want to test both of them, or how does that play in?
Genetic counseling or preconception counseling is very important. So obviously going through the family history, going through the personal history, all those things, anything we can alter, going through diet, your folic acid intake, those things are extremely important. Right now, everyone is offered non-invasive testing, and if they want invasive testing. So that term of advanced maternal age is really no longer used because everyone is offered these tests. Yeah, but we talked about in twins as, for example, in singletons, 35 years of age, and in twins, 31 to 33 actually years of age is considered advanced maternal age because you're carrying two. So, and when a wonderful mom is pregnant with twins, everyone is offered a nuchal translucency screen, and that's looking behind the baby's neck between the skin and the soft tissue. And that is also associated with a blood test, something two biochemical screenings that we do called PAP-A, or pregnancy-associated plasma protein A, and human chorionic gonadotropin. So that blood work, along with the measurement behind our baby's neck, the mom's age, and the baby's sizes, give us an odds risk. For example, for the most common abnormality, Down syndrome, which is the most difficult to diagnose as well on ultrasound. So most of the trisomies or more common ones are easier to diagnose because more than 90% of the time babies have other abnormalities rather than just a one quote-unquote soft marker that raises a suspicion for it. But Down syndrome, in about 50% of babies, if we have 100 moms with babies with Down syndrome, we'll miss 50 of those babies. We'll say everything looks normal on ultrasound. So these screening tests are really designed to identify, to help better identify which moms may be at risk for having babies, those angels with Down syndrome. So one is a nuchal translucency screen, and then the second one is a second trimester screening test, which again goes through that's a blood test, not associated with an ultrasound.
Okay.
And those results get combined and we get results. Then there's now non-invasive testing as well. There are different competing companies such as Harmony or Maternity 21, part of Sequenom, and these companies are basically looking for fetal DNA in maternal blood. That the data is still not very strong with multiples, but very strong in high risk women. And then there's invasive testing, which is chorionic villus sampling, which is done in the first trimester, either vaginally or transabdominally, and amniocentesis. And
and are there, greater risks, in doing those types of invasive treatments
with
for
multiples, there's a higher risk. For example, with an amnio, it's a 2.5% risk of potentially losing the pregnancy, the entire pregnancy. So definitely, so many of the women that we see in our practice, since we do more high risk, are patients that come in from infertility doctors' offices, and so sometimes these patients have already had pre-implantation genetic testing, so they already know for the most common chromosome abnormalities if these pumpkins have any, at least more of the common ones. So that kind of eases our mind. The previous panelist that was here, for example, said that she had a triplet pregnancy, but one of them didn't take, and she didn't know that until after delivery. So that, for example, would skew the numbers if she had non-invasive testing.
Okay, so the hormone levels would be off, right?
Right.
Yeah. Okay. Let's see here. We're going to take a break right now, and when we come back, we're going to talk about the reasons that it may be important to diagnose which type of twins you're carrying, or better understand what options you have during the pregnancy. Well, welcome back. Today we're talking about identifying twin types during pregnancy with Sean Danishmand, and our discussion continues as we look at some of the factors that may cause women to conceive twins. And in the case of higher order multiples, is it important to know their twin type? For the parents, we all want to know, and I guess we're going to continue the discussion that from a medical perspective, how important is it to know, and particularly in the type of care, the prenatal care that we're getting?
You're fabulous. No, I completely understand that. I think, and that's a question that always, parents ask, are they identical or are they fraternal? Again, as far as the management of the pregnancy, whether they're fraternal or identical, it really boils down to the number of placentas. That's where complications begin. And they're, if, like Sunny, for example, these angels have one placenta in separate sacs, but many times these babies share blood amongst one another because they're sharing the same placenta. And but in 10 to 15% of the time, they can have one of the most, unfortunately, bad complications with monozygotic twins or monochorionic twins, and those babies are identical, which is called twin transfusion syndrome. There are other abnormalities as well, but that's the one that we fear about the most. And depending on how early that's diagnosed, then the prognosis can vary. So if they're diagnosed very early in the pregnancy, then these babies most likely are going to require surgery, so fetal laser surgery. to basically burn, for example, those communicating vessels, because these are communicating vessels where one baby is giving a lot more blood to the other than is receiving back. So one angel gets so much blood that this baby just puffs up and gets bigger and pees a lot more, and so there's a lot more fluid. There's a lot. The bladder is much larger, and this baby is just so much puffier. And the other one is called stuck twin, because all of a sudden this baby's not peeing as much more because it's given a lot of blood supply to the other angel, is not growing as well, and so kind of gets stuck in the corner of a uterus. So that's why it's important. And again, when you have one placenta, you can just imagine there is going to be a higher risk for one of them not growing as well. So you're worried about growth restriction issues. You're worried about twin-twin transfusion. So you also have an increased risk for congenital abnormalities. With one placenta, the risk of congenital abnormalities goes up, but mainly really it's heart. So we talked about earlier in the earlier episode, we do an echocardiogram on all these beautiful babies.
On the babies.
Yeah.
Monitoring those babies. So let's say they share either a placenta, since that seems to be the most critical factor
That's the
there.
most critical factor.
So for in terms of the care, what is that care? I mean, let's just say we haven't seen any high risks yet, but how does the care differ once you've diagnosed that they do share either a placenta or a sac?
Okay, so if there's monochorionic one placenta, then these babies get monitored every 2 weeks. So once we see them, they get scheduled for a nucleotranslucency screen. That's, again, looking behind the baby's necks. That's also a screening factor for cardiac defects. Then they get their anatomy scanned. But starting at 16 weeks, we start looking at these angels, looking at the anatomy from head to toe. And then at 22 weeks, they get an echocardiogram to take a look at their hearts. And then after that, every 2 weeks, we look for, again, signs of twin-twin transfusion, which is, again, one not much fluid, smaller, the other one much bigger, fluid increases, no bladder versus bladder, a larger bladder. We look for growth restriction as well. So every 2 weeks they have an ultrasound. Once they reach about 32 to 34 weeks of gestation, they start going through the non-stress test, which is, they sit on these recliners and basically it's ice
chips.
It's ice chips, and it's a lot of work. My goodness. I know they come in twice a week, monitor the baby's heartbeats, and look at the amniotic fluid. Now, with two separate placentas, though, we don't do that as intensely. So every 4 weeks.
So not as frequent. So
no,
4-week ultrasounds.
4-week ultrasounds.
Okay, every 4
but, the biggest issue is, again, educating parents about signs and symptoms of preterm labor. So every 4 weeks when they come in, I mean, if we need to sooner, obviously we will. But if they're stable, they're doing well, like Shelly was, we look at their cervix every 4 weeks, look at the baby's growths, and those babies do very well. So now they do have a higher risk of developing diabetes. They do have a higher risk of developing hypertension, such as gestational hypertension or preeclampsia. So we do watch those. I mean, I tell my parents, get a blood pressure monitor. Every twin mom, I tell them, get a blood pressure monitor starting at 20 weeks, just check your blood pressure. I tell them, go on a low sodium diet. I mean, I talk about diet, I talk about their vitamin intake, and so be more proactive.
Yeah, in the monitoring. So maybe from our panelists, tell us a little bit about, your experience.
I was going to say, so I was one of those people that always had high blood pressure anytime I went to the doctor, just from the fear of everything. We'd had a miscarriage previously, so, going in, we were so nervous that it was sky high. So I did exactly that. I bought a blood pressure monitor and tracked it morning and night. And that was how I ended up developing preeclampsia. And I caught it at home. Your blood pressure suddenly 1 week is 10 points higher, and then the next week another 10 points higher. And so brought, my little book every time I went into the doctor to show them. And, they sent me down. I ended up being on bed rest in the hospital for a couple of weeks before developing HELP syndrome and then delivering the girls early. But, tracking my blood pressure at home made me feel a lot more confident that everything was going okay, and the doctors felt better too, knowing that it was just my nerves coming in to the doctor and not something else until it did become a problem.
Yeah, that's excellent, because that's what happens. The patient comes in and their blood pressure is elevated, and they've been checking their pressures, and they're like, in the past 4 days it has been creeping up, take a look. So it definitely helps.
My husband got high blood pressure when I was pregnant.
Is that because he knew the twins were coming? Because that may be my husband right now.
I monitored, and I would have the every 4 weeks appointment, and I have textbook perfect blood pressure. I did anytime that I would get swollen, because I did develop really like some abnormal swelling. My legs would get like really big, and at one
gosh.
point they were like
Yes.
like almost purple looking. So anytime that I would get that, my husband would make me go over to the pharmacy and use the blood pressure cuff there. It's not the most accurate, but at least it gave us an idea if it was, and it was always super, super low. So I just had, kind of abnormal swelling. And then just monitoring like how you were feeling and not being afraid to go in, especially with a twin pregnancy. I like almost passed out at an indoor mall.
Ooh, wow.
And it was just from, not being dehydrated and not,
How many weeks
trying to
were
do
you?
too much.
Do you
Oh,
remember?
goodness. 28, I want to say. Yeah, 28 weeks. Just I wasn't keeping enough food and water in my system. And then the same thing, too, with twins. You're at such high risk for preterm labor. You want to really be aware of, baby movement and any contractions. And I went twice to labor and delivery with increased contractions, and they just gave me water. I laid down for 3 hours. It was fine, and they sent me home. But just a lot of women with a singleton low risk pregnancy, if you're having Braxton Hicks, it's really not that big of a deal. But with a twin pregnancy, you really have to be more. I hated the idea of going in and having them just send me home. And when I got to the hospital the first time, they said, no, we would love to send you home.
Yeah.
Like our favorite kind of
Right.
patient is one that comes in and gets sent straight home.
Yeah.
We wish that you guys would come in more. So yeah, just being aware of.
You want, yeah. I think that's just great advice, just, to be, watching and sensitive to different changes. I know in my case, so I have identical girls, but we didn't know they were identical. We thought they were fraternal. And so I was getting just the monthly, ultrasounds. Well, I would go to my OB, and then 2 weeks later, I'd go to the perinatal center and then get the detailed ultrasound, and then 2 weeks later. So it did end up being every 2 weeks. So a lot of coverage.
Yeah, it does come out that we did the same thing. We'd go to fetal genetics and testing for the ultrasound, and then a week later, I would see my OB, and he would go over it with me, and then 2 weeks back to fetal genetics, and a week later, see my OB. So I've got a stack of ultrasounds. I mean, it's like 4 inches thick.
That's how they originally scheduled me. And then when I started seeing the perinatologist, she said, "You don't need to do all those other ultrasounds. I'm testing you every 2 weeks, so it doesn't matter." So then I got to cancel all of those.
Yeah.
Woohoo.
Yeah. Well, I still go every 2 weeks. I don't know if I really got out of anything, but
But yeah, it's definitely a lot of testing, I think, compared to a singleton pregnancy. Yeah, we all know that it's much more common to have twins earlier as far as the overall gestation period. Now, having and I'm always trying to say this correctly, a mono chorionic or a mono amniotic pair. Does that affect the overall gestation period? I mean, would you have
Yes,
maybe a
those
short
babies
pregnancy?
definitely get delivered sooner. So those babies are hospitalized, and usually we have them meet with one of the neonatologists, have a consultation as far as, okay, what are the complications associated with preterm delivery at 24 weeks, at 25, at 26 weeks? And parents make a decision. They say, you know what? We want to do everything possible. If you see decelerations in the baby's heart rates while you monitor these angels, then we want to get delivered at 24 weeks at the stage of viability. And so those patients get hospitalized at 24 weeks. If the mom says, we're not going to do anything, I don't want any kind of intervention until 28 weeks, we hospitalize them at 28 weeks. And those babies usually get delivered by 32 to 34 weeks, depending on if they're stable, usually by 34 weeks. Again, it's the fear that something can happen, without, and the consequence is usually bad. So they get hospitalized, they get frequent monitoring, they get betamethasone, which helps the baby's type 2 pneumocytes in their lungs make up surfactant, or proteins that make up surfactant, which allows these babies to breathe a little bit easier when they're born. And just really they're in the hospital mainly because of the fact that they're close to the NICU, and they'll be close to an operating room.
So you're saying, so the mom, so this is really, it's a consultation with the
neonatologist and the perinatologist,
Yes.
and they make decisions, but they're going to be hospitalized for the duration of the pregnancy.
The monochorionic,
That's
monoamniotic.
monoamniotic, so in one sac. So
Okay.
1 placenta, 1 sac.
and again, this is a fairly rare occurrence.
1%, 1% of
Yeah.
all monozygotic placentas are like that.
Okay.
Are identical twins. I know, so it's rare.
It's rare,
Yeah.
yeah. I
We
mean, I think we
get-
don't want to say this is not the case for most of the twin moms
no.
out there. Yeah.
But that's why, always parents ask, are they in the same sac? Do you see a membrane? And sometimes we see patients because, they couldn't identify a dividing membrane. It's very thin, for example. So because it'll completely alter the management of the pregnancy.
Yes. Okay. So that's good news.
Yeah.
Well, hey, thanks so much, Dr. Danishmand, for joining us today. So for more information about identifying twin types during pregnancy, or for more information about any of our experts or panelists, visit the episode page on our website. And this conversation continues for members of our Twin Talks Club. After the show, Dr. Danishmand will talk about some unusual twin pregnancies he's seen. For more information about the Twin Talks Club, visit our website, twintalks.com. Here's a question from one of our listeners. This comes from Leslie of Chicago. My husband and I just found out we were pregnant with twins. We have a singleton already, which I was able to nurse for at least 9 months. But I have to say I'm quite nervous about nursing twins, considering my milk supply came in a little late with my first, and milk supply always seemed to be an issue. I know you have another series that focuses on breastfeeding, but will Twin Talks also be providing specific information about breastfeeding twins?
Hey, Leslie, this is Sunny. I'm one of the producers on Twin Talks. And to answer your question, yes, we are going to be doing specific episodes focused on breastfeeding. It's a topic that's very important to all of us here at New Mommy Media. And we are going to be launching a series called Breastfeeding Twins, and that's going to be coming up here shortly. The other thing that I want to let you know, too, even though it's not specifically focused on twins, is that we have a sister show called The Boob Group, which is all about breastfeeding. And it's a weekly podcast just like Twin Talks, and it's hosted by an international board certified lactation consultant. And they have some amazing guests on that show, all of which are lactation consultants and in the industry of breastfeeding and have helped a lot of women. So that's another great resource I would point you to. The website for that is theboobgroup.com. But yes, we will be having episodes focused on breastfeeding right here on Twin Talks.
So that wraps up our show for today. We appreciate you listening to Twin Talks. Join in on the discussion by posting your comments on the Twin Talks Facebook page or by calling our voicemail at 619-866-4775. And don't forget to check our sister shows, Preggy Pals for expecting parents, The Boob Group for moms who breastfeed their babies, and Parent Savers, an online support group for new parents. And next week, we'll be starting our series, The Twin Baby Gear Essentials, and talk to experts about double strollers. This is Twin Talks, Parenting Times 2.
This has been a New Mommy Media production. The information and material contained in this episode are presented for educational purposes only. Statements and opinions expressed in this episode are not necessarily those of New Mommy Media and should not be considered facts. While such information and materials are believed to be accurate, it is not intended to replace or substitute for professional medical advice or care, and should not be used for diagnosing or treating healthcare problem or disease or prescribing any medication. If you have questions or concerns regarding your physical or mental health or the health of your baby, please seek assistance from a qualified healthcare provider.
New Mommy Media is expanding our lineup of shows for new and expecting parents. If you have an idea for a new series, or if you're a business or organization interested in joining our network of shows through a co-branded podcast, visit newmommymedia.com. Hey mamas, don't forget to check out Mighty Moms. It's our online community built for new moms just like you. Not only can you connect with other moms, but you can also join us backstage for special mom-only online events. And you'll also be notified when we're recording so you can join us as a special guest. Visit our website, newmommymedia.com, and click on the Mighty Moms banner. It's free. That's newmommymedia.com. See you there.